The basics of good health for older adults. As we enter our senior years, especially after age 60, both the body and mind undergo noticeable changes. Muscle flexibility decreases, metabolism slows, memory may decline, and the immune system becomes weaker. Taking care of our health during this stage of life is essential to maintaining quality of life and reducing the risk of chronic diseases or conditions related to aging. 1. Nutrition for seniors. Nutrition plays a vital role in health at any age, but it's especially important for seniors. Aim for a balanced diet with all 5 major food groups in appropriate portions. Focus on high-fiber foods, such as fruits and vegetables, to promote healthy digestion and help lower cholesterol levels. Choose easily digestible sources of protein, such as fish, eggs, tofu, or legumes. Avoid excessive saturated fats, sugar, or sodium. Drink enough water throughout the day, even when you don't feel thirsty, as older adults can lose fluids without realizing it. 2. Physical activity. Regular movement supports both physical and mental well-being. Seniors should engage in light exercises such as slow walking, stretching, or practicing Tai Chi for at least 30 minutes a day. This helps improve blood circulation, strengthen muscles, enhance balance, and reduce the risk of falls. Exercise also benefits the brain by improving memory, lowering the risk of dementia, and boosting mood, which can help reduce symptoms of depression and anxiety. 3. Mental and social well-being. Mental health is closely linked to physical health. Seniors experiencing depression or loneliness are more likely to face health issues than those with active social lives. Social interaction can greatly reduce feelings of isolation and stress. Find activities you enjoy: gardening, reading, journaling, painting, or joining community groups. Stay in touch with family and friends. Having someone who listens and understands can be the best medicine for the heart. 4. Annual health checkups. Regular health screenings are key to disease prevention. These may include checking blood pressure, blood sugar, cholesterol, vision, hearing, and bone density. Vaccinations are also important, such as flu shots, pneumonia vaccines, shingles vaccines, and tetanus diphtheria pertussis boosters. Prevention is always better than treatment. 5. Home safety. Creating a safe home environment is crucial for seniors, as falls are one of the leading causes of injury. Use non-slip flooring, install grab bars in bathrooms and on stairs, and keep frequently used items within easy reach. Avoid loose rugs without anti-slip pads. Check electrical wiring, ensure proper lighting, and keep a phone or emergency device nearby at all times. 6. Proper medication use. Take medications exactly as prescribed by your doctor. Avoid self-medicating and always inform your healthcare provider about any side effects or if you are using supplements or herbal remedies. Using a daily or weekly pill organizer can help prevent missed doses or accidental double dosing. 7. Oral health. Good oral health supports chewing and digestion. Brush your teeth at least twice a day, use dental floss or interdental brushes, and visit the dentist every 6 months for cleaning and checkups. Healthy teeth make eating easier, improve digestion, and help prevent bad breath and gum disease. 8. Quality sleep. Adequate sleep is a foundation of good health. Aim for 6 to 8 hours of sleep each night. Avoid caffeine or alcohol before bedtime and maintain a regular sleep and wake schedule. Keep your bedroom quiet, dimly lit, and at a comfortable temperature to promote restful sleep. Summary of Part 1. Caring for your health in later life doesn't have to be complicated. With consistency and intention, eating well, staying active, nurturing your mind, and living safely, you can enjoy a longer, healthier, and more fulfilling life. In the next chapter, we'll dive deeper into daily meal planning and nutrition tips, especially for seniors managing chronic conditions such as diabetes, high blood pressure, and high cholesterol.
Nutrition and meal planning for older adults. Eating in later life is not just about filling your stomach, it's about nourishing your body, slowing the aging process, and reducing the risk of chronic diseases. As the body ages, metabolism slows, nutrient absorption changes, and energy requirements decrease. In this chapter, we'll explore nutrition and daily meal planning for older adults, as well as dietary guidelines for those with chronic conditions such as diabetes, high blood pressure, and high cholesterol. 1. Key nutrition principles. Eat from all 5 food groups. Choose wholesome ingredients. Whole grains instead of refined rice, lean protein from fish, tofu, beans, and eggs, a variety of fresh vegetables, and fruits that are not overly sweet. Control portions. With slower metabolism, calorie needs decrease. For example, an adult who previously required 2,000 calories per day may now only need 1,600 to 1,800 calories. Reduce sodium, sugar, and saturated fat. Limit salt, fish sauce, soy sauce, sweet sauces, and sugar. Choose rice bran oil or olive oil instead of palm oil or lard. 2. Sample daily menu. Breakfast. Rice porridge with fish and ginger sprinkled with green onions, plus a small piece of fruit such as guava or rose apple, and warm water or unsweetened tea. Lunch. 1 small scoop of brown rice, vegetable soup such as kang liang, a boiled egg, and a glass of water. Dinner. A small serving of rice, stir-fried mixed vegetables with tofu, steamed chicken breast or grilled fish, chili paste with boiled vegetables. Snacks. Unsalted roasted peanuts, unsweetened fruit like apples or low-fat yogurt. 3. Nutrition for specific conditions. Diabetes. Control blood sugar by avoiding sweets, refined carbs, and large meals. Eat smaller, more frequent meals with high fiber from brown rice, vegetables, and low-sugar fruits. High blood pressure. Reduce sodium, avoid pickled or processed foods, and increase potassium from leafy greens, bananas, and tomatoes. High cholesterol. Limit saturated fat, avoid deep-fried foods, and increase healthy fats from oily fish, nuts, and quality vegetable oils. 4. Eating tips for maximum benefit. Chew food thoroughly to aid digestion, which may slow with age. Eat meals on time. Never skip breakfast. Drink water regularly throughout the day, even without feeling thirsty. Monitor how you feel after eating. If you experience bloating, excessive burping, or constipation, consult a doctor or nutritionist. 5. Foods to avoid. Strongly flavored foods high in salt or sugar, such as canned foods, snacks, and soft drinks. Beverages high in caffeine, such as certain instant coffee mixes. Alcohol, which can affect liver function and interfere with medications. 6. Do you need supplements? Some older adults may benefit from supplements such as calcium, vitamin D, vitamin B12, or omega-3 fatty acids. However, do not take supplements without medical advice. Your doctor can recommend what's best for your specific health condition. 7. Eating while traveling or dining out. Prepare healthy snacks such as unsalted nuts, dried fruit, or whole wheat bread. Choose restaurants that allow menu adjustments like no MSG or no added sugar. If your medication must be taken with food, always carry it with you. 8. Chapter Summary. Nutrition for older adults doesn't have to be complicated. With smart choices and balanced portions, food can be your best medicine, helping extend both your lifespan and your quality of life. In the next chapter, we'll look at physical and mental recovery, how to keep your mind sharp, prevent cognitive decline, and choose exercises that focus on rehabilitation and overall vitality.
Rejuvenating body and mind in later life. The senior years are a time to focus on maintaining balance, physically, mentally, and emotionally. Rejuvenation isn't just about addressing physical decline. It also means caring for the brain, memory, mood, and overall quality of life. In this third chapter, we'll explore practical ways to restore vitality for those aged 50+, so you can live each day with energy, confidence, and joy. 1. Why body and mind rejuvenation matters. As we age, our cells naturally deteriorate. Muscle, bone, blood vessels, and the nervous system work more slowly. Without ongoing stimulation and recovery, this can lead to weakness, cognitive decline, depression, or loss of independence in daily living. 2. Physical rehabilitation. Walking, the simplest, safest exercise for older adults. Walking 30 minutes daily boosts blood circulation and strengthens the heart. Yoga or Tai Chi improves flexibility, builds focus, and reduces stress. Resistance training. Light weights or resistance bands help prevent sarcopenia, muscle loss. Joint and targeted muscle exercises focus on knees, hips, back, and shoulders, common weak points in older adults. 3. Brain and nervous system care. Memory training includes playing brain games, chess, crosswords, or try recalling phone numbers. Learn something new, start gardening, or learn a new language to stimulate the brain. Read, listen to music, or watch films to expose yourself to new ideas and spark imagination. 4. Quality rest and sleep. Aim for 6 to 8 hours of sleep each night. Avoid long daytime naps. Keep your bedroom comfortable, not too bright, dark, hot, or cold. Avoid caffeine after 3 p.m. 5. Managing emotions and stress. Life changes, retirement, loss of loved ones can take a toll on mental health. Strategies include regular conversations with family members, joining senior clubs or community activities, practicing mindfulness or meditation for 5 to 10 minutes daily. 6. Social connection and relationships. Social interaction reduces depression and boosts life satisfaction. Join groups that share hobbies, gardening, singing, or exercising. Volunteer work can bring purpose and a sense of value. 7. Assistive tools and senior-friendly technology. Health devices, blood pressure monitors, blood sugar meters, and thermometers for regular checks. Health apps, medication reminders, step counters. Supportive gear, walking aids, and orthopedic shoes to reduce fall risk. 8. Consulting professionals. Physical therapists for chronic pain or mobility issues. Occupational therapists to restore daily living skills. Psychiatrists or psychologists for persistent depression, sadness, or anxiety. 9. Long-term self-care strategies. Keep a health journal. Track weight, blood pressure, mood, sleep, and medication. Set health goals, e.g., walking 6,000 steps daily or taking medication consistently for 30 days. Encourage yourself. Every small effort counts. 10. Chapter Summary. Rejuvenating body and mind in later life isn't about weakness. It's about choosing to live with quality.
With attentive self-care, you can preserve independence, stay healthy in body and mind, and fill each day with purpose and joy. Now that you understand the foundations of health, nutrition, and rejuvenation, you can design a life after 50 that's rich with energy, happiness, and lasting fulfillment.
Preventive healthcare for seniors. Later life is a stage when proactive healthcare matters most. Prevention is often more effective and less costly than treatment after illness has developed. Regular checkups, vaccinations, risk factor management, and paying attention to warning signs can help extend both lifespan and quality of life. 1. Health screenings and preventive checks. Blood pressure, at least once or twice a year. Blood sugar and cholesterol, annually. Vision and hearing tests every 1 to 2 years. Cancer screenings as recommended by your doctor, such as colon, breast, cervical, or prostate cancer. Bone density scans to prevent osteoporosis. 2. Vaccinations for older adults. Influenza vaccine, annually. Pneumococcal vaccine. Shingles vaccine. Tetanus diphtheria pertussis booster every 10 years. 3. Managing health risks. Blood pressure, reduce salt, exercise regularly, and take medication as prescribed. Blood sugar, choose high-fiber foods and reduce sugar intake. Cholesterol, limit saturated fats and increase healthy fats from fish and nuts. Maintain a healthy body weight. 4. Caring for key organs. Eyes, regular eye exams to detect cataracts and macular degeneration early. Ears, hearing tests and hearing aids if needed. Oral health, dental checkups every 6 months. Skin, avoid excessive sun, use sunscreen, and monitor for unusual moles or lesions. 5. Warning signs not to ignore. Unexplained weight loss. Shortness of breath or fatigue. Persistent abdominal pain or blood in urine. Sudden dizziness, loss of balance, or slurred speech. 6. Long-term health planning. Keep a record of annual test results for comparison. Set health goals, e.g., walking 7,000 steps daily or keeping blood pressure within target range. Prepare for aging in place by making home modifications for safety. Chapter Summary. Proactive healthcare is an investment in your future. The earlier and more consistently you practice it, the more you can reduce the risk of chronic illness and complications, allowing you to live your retirement years with strength, vitality, and purpose.